Looking at the situation here at home, South Africa recording 1,928 new COVID-19 cases, 38 deaths in 24 hours. The figures now stand at 702,131, with 18,408 deaths reported since the coronavirus hit the country in March. So globally, the figures of COVID-19 reached a record high of 400,000 cases reported in a single day on Friday, as most European countries experience a second wave of infections. To talk about our trajectory, senior researcher at the Center for Science and Industrial Research, Dr Ridhwaan Suliman, joins me now. A very good evening to you, Dr. Suliman. Always good to talk to you. So let's look at our situation. Are we going back to a period where we could see an average of 2,000 cases per week? What is our average cases per week?
Good evening, Tepi. So it's lovely to be with you again. So yes, let's have a look at our weekly data on firstly confirmed cases. What we're seeing is that the number of confirmed cases per week has sort of plateaued or leveled off at around 1,500 to 1,600 new confirmed cases per day. That's sort of the level we're seeing over the last few weeks. The graph that you show now indicates such, if you look at the bars of late. The numbers above the bars indicate the percentage change as compared to the previous week. So while we are seeing an increase in the number of confirmed cases, specifically over the last 2 weeks, and a 4.5% increase over the last week, I wouldn't say that this is any cause for alarm just yet. And the reason I say that is because we know that confirmed cases are influenced by testing. And we need to look closely at the testing numbers and the number of tests that return positive, or the test positivity rates, before we make any conclusions on this.
And we'll talk about that, the important combination that would at least say we are headed in that way of a second wave. I want to talk about the provincial incidents, the super spreader events, the Western Cape coming under the spotlight and others, and all because people are completely just disregarding the rules. No mask wearing, no social distancing, no sanitizing. So let's look at the incident rates in the provinces.
Sure. So the graph that we're seeing here shows the incidence rate, or the daily COVID-19 cases, as a 7-day average, scaled per 100,000 people in each province. What you can see is that most of the provinces have passed their peak. Northern Cape and Free State are sort of relatively high. Something to look out for going forward is the perhaps slight increase that we're seeing in Western Cape, or noticeable increase. It may be too early to tell, but something to look out for. You bring up the point about super spreading events, which I think is important. There's been a lot of theories about how the COVID-19 is spreading, and different factors that influence the spread. We've seen theories about the temperature, seasonal patterns, population distribution, etc. And there's merit to all of these theories. But something of late, looking at the epidemiological data, is considering that this particular pathogen is an over-dispersed one, and so it may be spreading in clusters and super spreading events. And so we need to recognize that, and that also has implications on how we manage or limit the spread of the virus. We have one example of our own that we saw very early on. There was a cluster outbreak or super spreading event at a church in Free State. And there have been other examples across the world, patient 31 in South Korea, for example. So I think this is something we need to also recognize. Essentially what it means is that rather than one person, say, infecting 2 or 3 others, something represented by the reproductive number, this is an over-dispersed pathogen. So we're seeing that 10 to 20% of infected people are actually responsible for 80% of transmission. And so it makes the modeling complicated, but it also needs to inform decisions and measures we take, either policies to limit the spread, but also ways in which we trace and test potential exposures and contexts.
Okay. I'm going to ask Dr. Suliman that we go through the average deaths at the moment to see whether or not there is a rise. And I want to immediately after that, if we could also look at the graph, but of course you'll explain it as well, that of testing. You mentioned how important it is to determine if there is indeed a reason or cause to think that there's a second wave. So let's start with the average deaths and then we'll move to the testing.
Yes. So what's striking from this particular graph showing the daily COVID-19 deaths on a weekly basis is the last bar, which shows that there are now on average about 130 reported cases per day over the last week. And this is a significant increase from the previous week, over 67% increase. So this is striking, but we need to look further into the reason for this. And that is because on the 8th of October, the Department of Health announced a change in reporting, or perhaps a change in the collating of deaths data. And provinces are now following recommendations of the Medical Research Council, which have been tracking excess deaths over the course of this pandemic. And so comparing the deaths with or reconciling the deaths with data from the Home Affairs, but also auditing the data on deaths with the surveillance reports, as well as from data from specific facilities. So essentially, what we're seeing there is more of a backlog in cases, or backlog in the reporting of cases, because since that announcement, the average daily cases over the previous 24 to 48 hours has been about... So
Dr. Suliman, let me just quickly jump in and ask you to go through the testing per week so that our viewers understand that before we run out of time.
Yes. Yeah, so if we look at the number of tests per week, we're seeing that this has also increased since the beginning of level 1, which makes sense because it was announced that our testing criteria has been eased since then. So the number of tests has increased to about 20,000 per week. And I think this explains the increase that we're seeing in the number of cases. What's important to look out for here is the number of tests that are returning positive, or the test positivity rate.
All right. Thank you so much for that. I wish we had more time to talk about the hospital admissions, because that's also important. But the big events that we should be looking out for, says epidemiologists, that is the 7-day average, if that increases consistently along with the testing and hospital admissions. So that will tell us just where we are. That was Senior Researcher at the Center for Science and Industrial Research, Dr. Ridhwaan Suliman. Right, coming up in the next